Okay. Hello, fellow classmates and Instructor O'Neill. This is my CT Urogram project for RAIT 310. I'm Doug Ward, and I just want to say that I enjoyed making this project. It was much more challenging and interesting. So, yeah, hopefully you enjoyed as much as I enjoyed making it. Okay. So, the setup for this urogram is I have a subject named Johannes Gutenberg, a 53-year-old man that had recently noticed a disconcerting darkening of his urine. And, sometimes you're just dehydrated. He didn't really think much of it at the beginning. He thought it just might go away with time. He started to realize it was a bigger issue than he originally thought once it noticed that there was more blood in his urine than anything else. And in addition to his hematuria, he noticed a sharp lower abdominal pain. Okay. Starting to get a little more serious then. So, in his past, he had experienced kidney stones throughout his life, so he more than likely realized that this was just kind of the same thing. But something just wasn't quite sitting right with him, and at the urging of Mrs. Gutenberg, he decided to visit the local emergency department. Johannes arrived on a particularly unbusy night and was triaged pretty quickly. Okay? Just to get this rolling a little faster instead of having to wait in triage for forever. I know, very unrealistic. Okay? He let the triage nurse know what his symptoms were, and she recorded them into her triage notes. Okay? The nurse also drew blood from Johannes, as was standard protocol, to check for possible infection. Please excuse the stupid stock photo. I know she's more than likely giving him some kind of injection instead of drawing blood, but I just thought it was kind of cool and spiced it up a little bit. Okay. Alright. So, the emergency room doctor at the time was a Dr. Richard Arnold, who spoke to the patient about his history of kidney stones, and as is, at least from what I have seen, he believed that he should order a CT abdomen pelvis without contrast, because that way they can see the kidney stones without the contrast obscuring anything, just due to them being a much higher density. And this would also allow them just to confirm where the stones were, how big they are, how many there could be. So just standard setup for this. Okay. So Johannes agreed, and a CT tech brought him to the department to perform a CT abdomen pelvis scan. He was placed feet first in the machine, and his identity was confirmed by the evening CT tech before the scan. First and last name, date of birth, your two standard identifiers for patients. The scan was over quickly after the 2 recon images were performed, and Johannes was wheeled back into his triage room. Okay, after about an hour, the radiologist, a Dr. Tin Huang, wrote in her report that she saw no evidence of kidney stones. Now I realize that this person in the picture is getting their head scanned, and of course they would not be reviewing those images right there in the room per se, but I just thought it was kind of a cool picture again. So she didn't notice anything as far as kidney stones go, but she did notice a little something on Johannes's bladder, and she recommended a follow-up urogram procedure to be done to evaluate for a potential carcinoma of the bladder. Okay, so this is a picture of the bladder on a CT without contrast, or abdomen pelvis without contrast. So as you can see, there is no contrast in the veins or arteries right now. You can see that there is something lighting up next to the bladder. This is not his by any means. I just wanted to show an example of it. So, yeah. Okay. So as far as my commentary upon the setup, I had Dr. Arnold perform a CT abdomen pelvis because I've seen emergency room doctors order it pretty regularly. especially if they have abdominal pain and a history of kidney stones. It's pretty standard. It is possible that he may have ordered an ultrasound, but I don't think it would be quite as likely in this case. And I just included a little picture of the ultrasound bladder, just to throw it in there for some spice. Okay. The reasoning is because it is harder to measure the size of stones with ultrasound, but it does spare the patient radiation, which is always a plus. Also, I do know that this procedure could have been done at the ED, but I don't think it would be emergent enough for the radiologist to recommend the ER doctor that they need it done now, especially at night. So urograms are generally outpatient procedures anyway, due to their non-emergent nature. Alright, so the radiologist recommended a CT urogram because of seeing something unusual in the bladder imaging. She could have seen some different densities, just maybe some asymmetry as far as the bladder goes. And bladder cancer is also seen much more frequently in men over the age of 50. The CT technologist could also have included in the notes that Johannes had a history of smoking when he was younger, and Dr. Huang could have also known that this is something that's been associated with bladder cancer, and I just cited my source there, so and you'll be able to see that book later in my sources if you're interested in looking at it. Okay. So it is also possible that the radiologist could have recommended an MRI be done instead. I've also read that surgeons mostly prefer this when it comes to imaging of the bladder, especially if you're expecting there to have to go to pre-op for surgery. So I just included a MRI picture, and if you have seen it before, this is kind of a preview as to what Johannes may or may not be suffering from. Okay, I'm going to talk about the procedure part of the presentation now. So Johannes was concerned about his test results, rightly so, and he called to schedule an outpatient procedure at the hospital so that he could get answers as to what was causing this pain in bloody urine, because obviously it was something a little bit more than a kidney stone. So he got his procedure set up for 4 days after his ED visit. It was a very fast process. They informed him that he should not have anything to eat or drink prior to his procedure. On the day of his procedure, he is promptly checked in by an imaging registration, is then introduced to the CT technologist performing his exam, Donnie. I didn't give him a last name. He's kind of like Cher, Prince, one name only. Donnie has him change into a patient gown, remove all unnecessary metallic objects like piercings and rings, and begins to walk him through how the procedure will go. Donnie asks Johannes if he has ever had any contrast IV before and whether he has any known allergies to contrast or iodine-based products. Johannes tells him that he may have had a CT done with contrast 30 years ago, but he can't remember. That is a long time. I don't think I could remember long. Okay. Donnie tells him that he is fine so long as he doesn't remember having any reactions. Johannes doesn't believe he did, but Donnie goes through the signs and symptoms anyway because he's a good tech, and just so to kind of let him know that if he feels any of these things, he needs to let him know immediately so that they can stop the exam and treat him properly. The kind of things he needs to pay attention to are itching, shortness of breath, hives, difficulty swallowing, closing of his airway. So if any of these things occur, Donnie lets Johannes know that he has to report them immediately. Okay? As Donnie is going over this information, he's also placing an IV in Johannes' arm for the contrast to be injected. Okay? He's definitely not going to be putting it in the shoulder. I believe that's probably the COVID vaccine stock photo right there. Okay? During this time, Donnie will also ask Johannes about any history of blood or cancer diseases and any history of diabetes. Okay. Johannes tells him that he's never been diagnosed with any diseases like that before, but he does have a sporadic history of kidney stones. Donnie also reminds Johannes what it'll feel like once the contrast is being injected. He'll more than likely feel that warm and flushed sensation, maybe taste something metallic in his mouth like he's been sucking on pennies, and possibly a peeing sensation. Okay, these are all very normal side effects of the contrast. Okay. After the IV is placed, checked, and flushed to ensure there's no chance of extravasation, Donnie makes sure that everything is okay with Johannes before they begin to proceed the procedure, and if he has any questions. Johannes confirms he understands and is ready to begin. Donnie has him lay supine on the couch with his feet facing the entrance to the gantry. Okay, so he then asks Johannes to bring his arms above his head so there are no artifacts caused by the arms being in the images. Donnie places straps over Johannes' abdomen to keep him still and prevent motion on the images, especially since there's going to be multiple series. He centers at about 2 centimeters or an inch above the kidneys and about elbow height. And I just want to point out in the picture, of course, that he's backwards and that's a head scan. So, yeah, that again, it's just a nice stock photo. Okay. Donnie takes his 2 scout images to ensure he is covering the right anatomy to set up his scan boxes. He covers everything from just above the kidneys down to right below the pubic symphysis. The first scan is done without contrast to evaluate the structures and give the radiologist something to compare it to. And I just have a stock picture of scout images, so yeah, he's not going to need all of that. He's just going to set up his scan boxes for just what's relevant to the procedure. Okay. After the first scan is complete, Donnie would inject about 125 milliliters of contrast at a rate of 3 milliliters per second and 200 milliliters of saline at 1 milliliter per second. The second scan is usually done after the contrast is injected, and the patient waits for about 10 minutes so that the contrast can filter down to the bladder, through the ureters, and of course go through the kidney, just light up the whole urinary system essentially. Okay. Donnie would have informed Johannes about this delay so that Johannes isn't just sitting there getting more and more upset, and also the importance of him not to move around so that to ensure that all the anatomy that's in the original scan is also in the second scan. Okay. After the second one is complete, Donnie would pull Johannes out of the machine and inform him that they're all done. He would also let him know that he is able to use the bathroom, empty that bladder, and also to let him know to drink a lot of water to flush his kidneys out and get that contrast moving. Donnie also lets him know that the radiologist will read the exam and send the results to the primary care provider. Okay. So I was trying to be as thorough as I could, but I read a few variances on this procedure. Some places have the MICU nurses place the IVs, some the techs place them. If Johannes would have had allergies, they would have premedicated him with Benadryl. I also did read that some places actually administer them diuretics to make sure that they're producing urine even quicker for these exams so they don't take forever. Okay. According to the CT procedures book, or our procedure book, sometimes they even have them drink about 16-ounce glass of water prior to the procedure. That really fills up the bladder, and that way the radiologist can see it in its entirety instead of a little tiny shrunken thing. Okay, and honestly, I think that would have been a good choice, but again, it wasn't universal in everything that I read. Donnie could have shielded the patient's thyroid. It's never a bad idea, but he definitely couldn't have had him wear the full outfit for obvious reasons because of the section that we're scanning. So I also read that some facilities would have an option for a third scan without contrast after the patient voided, just to make sure that there's no perforations anywhere in the system. So you know, see that contrast start to leak out into the body cavity. But I didn't include this because they didn't really suspect he had a perforation, so I didn't include that in this exam, but it is possible depending upon the Johannes Gutenberg did find out, unfortunately, he was suffering from bladder carcinoma. He is scheduled to have a cystoscopy performed so that the surgeons could find out how best to treat him. It's also to see if the carcinoma can be removed or if it's severe enough that he'd have to have his bladder taken out entirely. And I did include a picture of a little tiny carcinoma. And you can see that contrast, and they're really highlighting it well too. Okay. So, in conclusion, Johannes did have a biopsy performed on his carcinoma to determine its level of malignancy. He will more than likely not be having to have his entire bladder removed, but one of the things about this type of cancer is it does tend to be repetitive. He is scheduled to have his surgery in the immediate future. Okay, so this is kind of my final commentary upon everything. I really did learn a lot from this project, and I enjoyed it far more than I thought I would, if I'm being honest. It made me go out and visit quite a few websites, and I even looked at some of my old textbooks to get some ideas about what I was going to have poor Johannes suffer from. And I've also got to see, thankfully, quite a few CT procedures and kind of drew a lot of that into this. Never a urogram, but still, I was able to kind of imagine what it would be like. Also think that more than likely Johannes would have actually had an MRI done. From what I understand, it is what most surgeons prefer to see. But as far as the story goes, in our project, I just could have said MRI was unavailable or is booked way too far out to be of use to him. Okay. Or maybe he just didn't like it. So I know you can also do a retrograde cystogram using a fluoroscopy, but I don't think that would have necessarily been the best option for him. From what I understand, it's largely used for trauma situations. Like I did get to see a 65-year-old guy separate his pubic symphysis after having an accident in ATV, and so they did perform one of these on him, but it was largely to make sure he didn't rupture his bladder or damage his urethra. And I did include a little picture of what bladder cancer looks like on a fluoroscopy study right there. Or I'm sorry, that's actually just a spot shot. Okay. Also, I do prefer writing in the third person, so that's why I didn't really inject myself into the story. So hopefully that wasn't too annoying for anybody. It was also more fun to make up characters and names, and just allowed me to, have a lot more fun. And these are my sources if anybody wants to go check out where I got all this stuff from. But yeah, thank you very much and have a good one.